In terms of the theme of the World Diabetes Day 2021, access to diabetes care, if not now, when? I think that's a very apt theme. I think knowing insulin has been around for 100 years, knowing the imperative that it plays in the health of these patients, it is clear that we do need to essentially put in time and action now. I've heard of all the asks that have been highlighted here. Zipporah had asks for us when it comes to prevention, primary health care. Dr. Njenga has had asks for us when it comes to financing of diabetes and NCDs. Those asks we have heard. I can tell you, I am one of the people who really push when it comes to NHIF because that is my soft spot. I'm a health financing specialist at the end of the day. And one of the things that we've been doing, and I'm glad, and I'm sure the ICC is involved in this, is in designing that benefit package for NCDs. And so it's a bit ridiculous when we hear that a member of NHIF can say, come on towards the end, when we've sat with them in boardrooms and had those discussions of, at the end of the day, that your books would balance better if you caught these people earlier as opposed to later. I'm sure you've seen lots of stories, hue and cry, NHIF saying they're bleeding money with dialysis. So you're bleeding money with dialysis, yet you could have handled it a little bit earlier. And so these are discussions that we're having with NHIF to ensure that that's aligned. One of the things that I'm most proud of, and perhaps would be the legacy that we leave around in the Ministry of Health, is the NHIF Bill. The bill is currently in Senate right now, and the Senate committee is in Mombasa, in fact, trying to conclude the report of that bill. And the idea is that the bill will mandate health insurance for all of us. And why that's important is, once we are all in that basket, once all of us, all 47 million of us, all 40 million, KBS will tell us how many we are. If all of us are in that basket, then it means that that benefit package that you need in the NCD space will be available.